and we're going to hear from Altaf Kazi. Now, Altaf has worked in NHSBT for 3 years as Assistant Director of Partnerships and Community Engagement, having previously worked in the commercial, public and third sector. And currently, Altaf's got the responsibility for our partnerships and community activity within NHSBT, leading partnerships with a spectrum of organisations from multi-billion-pound businesses such as Disney through to over 100 grassroots organisations via the Community Grants Programme. And Sarah Trumpeter started by saying 80% of the patients who this work is relevant to live in London. So now we're going to hear something very important for us here, but important nationally, is recruiting donors from Black heritage communities. Over to you.
Thank you. In today's presentation, what I'm going to be doing is I'm going to be discussing Black heritage, recruiting blood donors from Black heritage communities, looking at the barriers and looking at what we're doing within NHSBT. If we can move on to the next slide. So in particular, kind of like really focusing in on all of the concerns that we hear from Black heritage communities across the process, and then looking and really exploring into some depth as to exactly what it is that we're doing within NHSBT, within donor experience, and particularly within my team, which is the Partnerships and Community Engagement function. If we move on to the next slide. Now, when we discuss barriers, it's really easy for us to kind of like just talk about barriers in a more general sense, and just list off a number of different things that we believe a number of different things that we think hinder that journey. But what I've tried to do in this presentation is that I have broken this down into 3 areas. So there are barriers that kind of like form in 3 different parts of the pathway of an individual donating. There's one in and around the barriers in awareness and in creating awareness. Then there's something that we call active consideration, which is when a person already is aware, and they're considering donating, what are the barriers at that point? And then lastly, what are the barriers when it comes to doing? So we're going to explore the barriers. We're going to look at some of the themes that emerge from the barriers. We're going to look at some of the kind of some of the behaviors we're looking to change, and then we're going to look at some of the activities and how we go about doing that. So moving on to the next slide, which is a very busy slide. I do take that. It's a very busy slide. So if we look at the first kind of column in the slide, this is the barriers within awareness. So barriers include, people not being aware or don't understand the specific need for Black heritage donors. And this is where people, will come forward. And this research was taken in conjunction with an agency that we work very closely with, where they went out to a number of different Black heritage donors. And when we talk about Black heritage donors, it's not a homogeneous group. It's the group. It's not a homogeneous group. There's a spectrum of opinions because it covers such a vast a number of people as well. So I just wanted to put that out there as a caveat first. When we look at awareness, we look at kind of, the barriers that include I'm not aware. And this is where people don't give blood because they don't think that their blood is valuable or needed, or don't understand the importance of matched blood when it comes to RO. There's a lack of awareness sometimes about sickle cell. And it's sometimes people will be like, I don't want to give blood because I think it's going to go to waste as well. So there's that kind of whole thought process around not understanding the specific issue. And for us within the team, it is really about us using emotion and messages to explain the specific need for Black heritage donors, and to ensure that we can hold their attention with content that's culturally appropriate and delivered through messengers who are trusted as well. And so you're going to hear me repeat this on a number of different occasions in terms of using culturally appropriate content and using culturally appropriate vehicles as well, where there is a huge level of trust in those individuals, and then kind of relating that back to the wider context of NHSBT, as I'll come back to towards the end of the presentation. Other barriers also include, I'm not sure if I count or identify as Black heritage. Like, what do we mean by Black heritage? What about blended heritage or partial ethnicity? Those are questions that sometimes come up, and here we need to just reinforce the messaging, creating a halo of using the images that we use to ensure that they're more inclusive, that they demonstrate the spectrum of donors that we're looking for. society doesn't support me, so why should I give back? There is that feeling that actually I'm not being helped, and it's not directly helping me, my family, or my community. And then there's also sometimes feeling and sentiment that it's unfair to burden this on me. And I think when we look at this, and we look at the back end of the pandemic, and we look at a number of different health inequalities, we're always talking to communities or talking at communities about how they are impacted and how they are affected adversely. And we're always like, oh, if you're from an ethnic minority background or a black heritage background, you're more likely to have X, Y, Z, X, Y, Z, X, Y, Z. Here we need to kind of really work with, as I mentioned, using the messengers that we can work with, the partners that we can develop relationships to model donation behavior, to demonstrate that actually there is a, you know, that people do trust the organization, do trust us as individuals, and starting to create the new norms that it is normal to donate blood. It isn't different. It isn't a taboo, as goes within this. Now, the fourth one talks about mistrust of the NHS, and I think this one's probably could have been termed more mistrust of, I wouldn't say authority, but I would say governmental organisations. And I think there's a rich history here of that we can explore when it comes to why this mistrust has arisen. But the fact that it exists is something that we need to work with. I think there was a government report, which hopefully I can find and share later on with the group, that demonstrates the large percentage of people from Black and minority ethnic backgrounds that have a mistrust for authority. And I think this, to some extent, was reinforced by the messaging during the pandemic, where we were talking about health inequalities and where ethnicity, you know, was related to the adverse effects of COVID. So I think that's things and systems that we're working in when it comes to awareness. And sometimes there's just that feeling that I'm not eligible. So there might be some misinformation around, you know, I have sickle cell trait, so I can't donate. I'm not a British national. I've been to a country with a high malaria risk. There's all of these sometimes kind of like thoughts. Some of them are right, and some of them kind of like we'll check out when it comes to our, you know, our health indicating our survey that we do prior to donation. And this is where we've got to use you know, social media initiatives or activities to myth bust. And I'll kind of show you, like, these are just sporadic responses that we've developed, but this comes together towards the end in terms of a holistic approach that we have towards this. So those are kind of some of the barriers that we see when it comes to awareness. When it comes to barriers, when it comes with active consideration, this is where a person is, you know, moved on beyond the awareness pace, and they're really thinking about donating. And the barriers here can be, I'm more likely to feel I'm more likely to feel I'm too busy, where people feel like they can't find a session, they can't find a slot that's appropriate for them, that's suitable for them. Maybe something to do with time, maybe something to do with the way that they have shift patterns, or less predictable work hours, or, you know, things that they're managing and balancing at home. And I think we've got to be able to use messaging that demonstrates the flexibility in what we do, the sessions we have, the areas that we're in, and the focus that we have within those hyperlocal areas. And I know that we were just mentioning that actually a significant proportion of the Black heritage community live within the London area, and it's about making sure that we're in the right areas, having the right conversations, and motivating people to move into the right direction. And then it's about making sure our services exist within those areas as well, and that we're able to find the right locations for them. Another barrier might be, I'm more likely to feel blood donation could be a risk to my health. And sometimes this can be myths that exist. I don't give blood because, you know, it might be a risk to my my health. I'm more commonly a heightened fear of needles. You know, truth being told, I probably had to overcome my own fear of needles when I started working at the organisation 3 years ago. So I know it can and it does exist within all communities, but it can exist within different communities as well. In this particular instance, we're talking about Black heritage donors. And finally, when it comes to kind of like the barriers to action, so this is where they've had the active consideration. They're about to do, but there's some concerns and some barriers for them to actually come forward. And when we're speaking to the community groups that we work with, they sometimes say, you know, I don't relate to the people in the donor centre. That can come up as a concern. You know, I'm not sure if I'll feel welcome or respected. It's not convenient. These are all considerations that can actually come up at that time and be barriers. And for us, it's about using messages highlighting Black heritage donors in our comms, and ensuring that, you know, our donor center imagery demonstrates that when it comes to those donors who do come forward and donate. And I think when it comes to it's not convenient, it is really about kind of advertising what is available, what sessions are available. And I know that we're working through, you know, a more difficult moment and a difficult time at this moment in terms of, you know, having staffing, and we would, you know, just alluded to before that we have nursing to consider as well. So I think it's for us to actually have a look at that, what's available, ensuring that we promote that as much as possible. So when it comes to all of these barriers and all of these, the blue boxes that you see, kind of like, you know, using messages, you know, re-enhancing the reputation, these all based on the premise of developing relationships, building trust, and ensuring that we can take people down the pathway to donate. Those are the really three key important principles that we want to follow. And in order to follow those, we've got to be able to, you know, deliver campaigns, whether that's Black History Month, whether that's working with Disney and Black Panther, or whether that's, you know, a huge PR call similar to the one that we had before we went into Amber around Black heritage communities that saw significant response. In fact, it saw one of the largest responses we've had from the community to come forward and donate blood. And whether it's the community engagement, the grassroots engagement that we're having on the ground in developing those relationships, you know, the enrollee activation. Sometimes people have, you know, enrolled but haven't been able to find appointments, and it's about ensuring that we can we can get them booked on as well. Social media is always key, vital, alongside like with that influencers piece. In October, I believe, we ran an activity in Stratford where we had, you know, between 50 and 100 of about 50, sorry, about 50 really popular social media influencers. I'll name a few just in case anyone recognizes them. Harry Panero, Akinfenwa, Michael Dapper, along with others who came forward to donate and promoted it on their social media channels. And this isn't a one-off instance. This is about us stimulating that longer-term conversation so that we can encourage people from within those communities by using trusted partners, trusted voices, and demonstrate that, you know what, this has an impact and makes a big difference. Lastly, moving on to you know, some of the other activities that we do to enhance this. So we do work with community groups, and we have a community grants program. Our latest community grants program had almost 54 organizations that came forward, and they will promote things across the spectrum, whether it's blood, organs, plasma, not plasma, stem cells. They will come forward and they will ensure that they create the right environment to deliver the message, and they create more culturally appropriate messaging. Now, mention culturally appropriate messaging, what can that be? That can be spoken in the language or delivered in the style that is more conducive to the audience, and it comes from a more authentic place from within those communities, so they're able to drive that messaging. We also have a lot of inbound activity as well, where people are coming forward and stepping up and want to respond as well, and want to volunteer, want to help us to encourage and motivate more people. So those are the kind of like types of activities that we're undertaking at this moment in time to ensure that we can drive more Black heritage donors and encourage them and motivate them. But like I said, this exists on a spectrum. There's a number of touch points that we have to create. So a popular saying that I normally use within the teams is a person will need to come across a piece of information between 6 and 7 times, according to Salesforce, before they act on a piece of information. So it is about ensuring that we provide that message as many times as we can within those settings to encourage people to come forward to donate. Really mindful of time. I've whizzed through that. If there's any questions, please do let me know.